I gane wetakwalo na ihe mmemme no no Igbo na onu Igbo maka ofonye obia ni ano adira aburo onye Igbo mana onwele ozi dị mkpa oji maka webe, so we'll be alternating Igbo and English language in this particular segment of Good Morning Anambra. Okay, and the topic we are going to be exploring today will family planning response in Nigeria, the TCI, that is the Challenge Initiative, and the Anambra State Government partnership experience. And we have as guest this morning Dr. Victor Iyaro, Director, TCI Nigeria. You're welcome to the program.
Thank you so much for having me.
We also have Stella Ekwozo, State Family Planning Coordinator. She's also Deputy Director, Nursing. Welcome to the program.
Thank you for having me.
Okay, let's start with Dr. Victor. Let's talk about the Challenge Initiative. What is all about, the mandate?
Thank you so much, and good morning, Anambra State. So the Challenge Initiative is a global initiative that is led by the Johns Hopkins University, Maryland, USA, and implemented in Nigeria, by the Johns Hopkins Center for Communications Program. So the Challenge Initiative is currently in about 12 countries. Clustered around 4 hubs, and Nigeria is one of those hubs. And the mandate of the Challenge Initiative is to provide support to government to lead and drive family planning programs. And I just want to spend a bit of time to talk about why family planning. And usually when they ask me why family planning, I say, why not family planning? If you look at our current economic situation, you agree with me that our resources are overstretched. There's a very high rate of urbanization. People want to move out of the rural areas to the urban areas. The facility, infrastructure, schools, hospitals, even roads and other amenities are overstretched, And the economic reality also suggests, that families are really struggling to keep up, with meeting their immediate needs. And one way that we can do that is to ensure that families are able to have the number of children, that they can cater to. But most importantly, the health of the woman is preserved. Like we promote that women should adequately space their children so that their body fully recovers before the next pregnancy and they are able to, live healthy lives. But unfortunately, there are technologies that have been made available for women to be able to have access to these novel, services, but they are not mainstream. They are not available in our facilities. So how do we help government to ensure that these technologies are available so that women and families that desire, to have, access to family planning services can do so? And that's why the Challenge Initiative is here. Okay. So we still get to the point where you tell us how you've been helping the government to do that. Absolutely.
All right. Let's come to you, Stella Ekwozo. Actually, because na kitabo family planning, and I'm no for the catch us and then na kana three men no for the gache gota and then magasero body ifuna wani nya ispesi maloto gesi na mwa malumbo gelu asina osina omusigo no yara amuse idi na enanya fuka obodo si wede
Debu etufu oge family planning. When we talk about family planning, we need to know what family planning is all about. In simple terms, it's just a decision. I say it's a wise decision taken by individuals and couples to have the number of children they can cater for, and to have it in such a way that it is spaced out. Intervals between pregnancy at least will be 2 to 3 years before the woman gets pregnant again, like the director just rightly said. So it's just children by choice and not by chance. So dere mkpa na ndị be anyị gere ntị maka ihe gbasara family planning na maka na uru ọ bara karịrị akarị. Ọ bara nwoke uru, bara nwaanyị uru, bara ụmụntakịrị uru, bara community uru, bakwalu obodo anyị bụ Nigeria uru. Inebe anya kita na Nigerian population, we are over 233 million people in Nigeria, going by our data. So, kwesịrị ka mmadụ mụrụ ono ya azụ fọ onye nne richie na-arụ ya ọfụma wee chịkọnata onye tụ ime adụrọkwa n'izi ọ chịkọnata o wee mụọkwa n'ọzọ onye nna stresses of ichere ụmụazị anyị azụkwa n'akwụkwọ anyị emekwa nka ka ya emekwa nke ọzọ ịfụni obelata nwoke adị enwe na BP maka na ụmụ nwoke ụfọdụ na-agbapụkwanụ maka ihe gbasara ezinụlọ mgbe ọ mụrụ m juo ụlọ ihe ọ ya emebizi ọgba ọsọ gbapụ ọsọ n'ụlọ ọsị nwaanyị na ụmụ ya ha mazịkwa ịkọtago o nwere ihe o mere o jee na biya palọ o jee ebe ahụ ọgụde mmanya ọṅụjuo afọ ọ batakwa n'ụlọ mmiri dọrọ na-ejide ọrụ nwa nkịta ibe na-echeri ya cheri ya ịlalụchakwa ụlọ dị ifetofe alcohol pụọ ihe ị na-ebidokwa dakwala gị n'ụkwụ ma nọ gị ka ọ dịrị anyị azụ ụmụazị na skuul ụmụazị enwe jee akwụkwọ ọfụma gụọ akwụkwọ ọfụma nwee ya na-akpọ quality education itinye nwa gị na skuul zụọ ya azụọ maka na ezinụlọ dịkwana mma obodo adị mma society adị mma ụmụazị ejere akwụkwọ ọnya butere ị na-afụ ụmụazị ya na-akpagharị na streeti na-eme ihe arụ nke ma nke ọzọ ọ maka na azụrụ azụ maka na a sị na amụta azụrụ azụ ya na ume ọma bụrụ ofu ya bụ na o kwesịrị na ihe gbasara family planning anyị kọba uru ọ bara tata chi ya eji chi ya bụ na ihe gbasara otu ihe si wee kwụrụ kịta ịzụ nwa na skuul ya ama ego n'ọbụ irigoro nri ọnụ ya ama ego n'ọbụ ya bụ na o kwesịrị ekwesị bụrụ ihe ziri ezi ka onye ọbụla chịkọta ezinụlọ ya mara ole ọ ya azụ mụọ.
Let's come back to you, Dr. Victor, talking about the Challenge Initiative and Anambra State Government Partnership experience. Now, before we talk about the experience, we want you to tell us the programs that you put in place, because earlier you said that you're trying to help the government to see that some of these facilities are made available for the people that needs them. So what program, or do you see, have you started, or have you done, or do you intend to do a program that will help the government?
All right, thank you so much for that. So I would say that we've thoroughly enjoyed working with Anambra State in the last 4 years. Okay. Unfortunately or fortunately, in fact, I would rather say fortunately, we're at the point where we're making a transition in that partnership, you know. Okay. So just to quickly describe how Anambra State came on board, one of the modes by which we engage our partner state government is that they have to express interest. Because we recognize that if the government does not see the need and the priority, you know, to implement or prioritize that program, chances are they will not back it with the right political commitment and will to drive and lead implementation. So Anambra State was one of the set of states that expressed interest, and so they came on board about 4 years ago, and since they came on board, we supported the state to develop a very comprehensive program which has spanned over the last 4 years. And our programs are anchored on four key areas. One is that we need to build visibility for family planning within the policy space. We also need to amplify voices of champions to let people understand that family planning indeed is not just a human right, but is a priority. It's a development priority. Just the way you have, you know, food security and all of that, family planning is a development priority. The second pillar is making sure that services are available at the point of care, you know, in our primary healthcare facilities, in our general hospitals, and any point where people can access services. Then the third pillar is going to the communities to stimulate demand for these services. Because imagine that you have services in the facilities, but people don't know about it, or they cannot have access to it, or they have social barriers to being able to have access to those services. So demand generation is actually our third pillar. Then the fourth pillar is how do we use data and evidence to inform practices, to inform improvements in services. So our programs are hinged on these four key pillars, and over the years we've worked with Anambra State to implement high impact activities or high impact interventions built around these four key pillars. One of the cardinal interventions that I think is very well celebrated in the state is what we call the 72-hour makeover. You know, it's a very cost efficient, very agile, and in fact it is what we need in this climb, because when you have paucity of resources, you don't have all the resources to do everything. You know, in 72 hours, we transform a health facility from a dilapidated state to a functional state. Yeah, I know you're surprised.
I am. I am.
So we have mastered the technology, we've mastered the process, and you shut down the facility on Friday, and by Monday people go to those facilities and it's totally transformed. And that really reinforces the power of community. So it is community driven, community led, no bogus contracting, direct implementation, getting the people involved in transforming their own facilities, and it's very cost effective for a fraction of the cost that you would have done if you were, contracting the renovation of the facility. So that's one of our flagship initiatives, of course, amongst many other initiatives.
And that has been done in how many communities in Anambra?
4 facilities.
Okay, 4 facilities.
Yes, so it's a model. It's a model that we are promoting, and may I just also mention that we are currently in 14 states in Nigeria, and that spans over 120 local government areas. So we're implementing these models in different areas with the expectation that government will see that it works, it is viable, and they can adapt it and scale it up even for other areas beyond family planning to other health area, maternal, newborn and child health, and possibly even education. Our schools are dilapidated and all of that. It's a model that could be implemented. And I also want to say that other countries have actually come to Nigeria on a learning visit to see how this model works, and they are even taking it to scale.
Oh, that's quite impressive.
Yes,
okay, I'm short of words there,
yeah, exactly.
but then
if I may add to that.
Okay.
Yes, when the TCI came into Anambra State in 2018, there was a meeting at Abuja, and one of our commissioners for health, Dr. Joe Akabike, went for a meeting, and they showcased their demand-driven model. They say it's business unusual, and then requested for expression of interest, like he said. And my commissioner opted in to receive these benefits from TCI, and that's when it was approved, and they came into Anambra State 2018. And they say they are disseminating their, I don't want to say it's end of project dissemination, and they want to leave us. Though we are not happy they are leaving, because they have done wonderfully well for the state. Like the 72 hours makeover he just mentioned, I call it the magic of TCI. I have never seen or heard of anything like that. That an old building will be transformed into completely a new building within 72 hours. That is 3 days. From Friday and Monday, it becomes a new facility. And they have done it in 4 facilities in Anambra State, which the Honorable Commissioner commissioned 2, and the ES, Executive Secretary, Primary Healthcare Development Agency, Dr. Chioma Ezenyim, also commissioned 2. So that is one of the high-impact interventions they've done in Anambra State. There are other ones, like the e-reach services. Initially, we were conducting outreach, but they came and said it's in-reach. And we saw that it's results-oriented. Like he said, that the facilities will be there and that people will not go in there. They will not even know they have such facilities or the services happening in the facility. But with these e-reach services, people can now access services in the facility. And they will even know it's a kind of way of advertising that facility, that we have such facility offering such services in the catchment area. Also, they inaugurated the QIT, the Quality Improvement Team, within the facilities, because when they came, they started with 7 LGAs and 30 facilities. But they later extended to 11 LGAs and 45 facilities. So all the high-impact activities they are implementing are across all these LGAs. So they instituted the Quality Improvement Team, and the essence is to encourage community involvement, participation, and ownership. And we worked, wonderfully well with those community members, because
I really want us to talk about this 72-hour transformation because it's quite interesting.
Yes.
Now, how does this work? Do you engage the services of the communities? And then about the finance too. So how do you get the money you used to do all this in just 3 days?
That's an interesting question, and I like to approach it from two perspectives, right? So there's the financial part, there is the technical part, right? So from the financial part, one of the key principles of our partnership with government is that as a development organization or as a donor, donors can't solve all of our problems. Government still needs to own, to drive and invest in the programs for its people. But unfortunately, over the years, with a lot of donor funding coming in, government sort of has relaxed on its responsibility, and is not putting as much resources. Of course, we recognize that funds are not there. Resources are very lean, yet the problems keep piling up. So what we wanted to do is that, can government use the little resources it has more efficiently? And that was why we designed this model such that with just a fraction of what government should have spent if it were doing a huge renovation, it just spends a little of that and it still gets, the same result. So we identified all the critical leaks, financial leaks within the entire process of a renovation. For example, contracting, procurement, all of those things are places where you have operational leaks, and both financial and operational leaks. So we identify those and we streamline them. The second is we found ways of leveraging resources, and it's also consistent with our business unusual model. So for TCI to operate in any location, any state, the government must bring part of its resources while we bring part of our resources. So it's a partnership, not just technical partnership, but also financial partnership. And so when you have those resources coming in, it becomes easy for even community members to put money on the table to say, hey, we like what you are doing. We like that government is committing to it. I also want to commit to it. In some locations, we have philanthropists coming in to say, we want to put in 10 bags of cement, or we want to be responsible for the roofing sheet and all of that. So that's the financial part. On the technical part, we have been able to identify how you can simultaneously implement certain parts of the renovation, at once, without waiting for one part to finish and you now start another part. So once we deploy on Friday, every unit is working. And we use community people. The interesting thing is, if you come to where 72-hour makeover is being done, community people have their lamps. They have people are running their generator just to make sure that that facility is implemented by Monday. We also have community people volunteering to be security. They are volunteering to go to the markets to procure. It is so exciting because you can see it in the faces of the community that they really own this and they really drive it. And the interesting thing is that they also protect those facilities after the renovation is done because they know that they have a stake in it. So that really is how the magic happens. It's people devoting themselves and committing to driving the development that they want to see.
Okay. Stella, let me come back to you because this is an interesting project. Mana ibia achom ka ijilonu iwe kwue ka ndi Anambra kachase ụmụ nwanyị ndị na-eje ụlọ ọgwụ si welitego ezi elele na nya bụ initiative.
Okwu ekworo nkwucha. Akụkọ ekworo anyị kọcha ka emechara ihe a. Ya bụ ka chọọ ibido ya na-asị ya ọ ihe ka ya ihe eme ọ dị possible. So ụmụ nwanyị itere ezigbo elele maka na ha bịa na bụ 72 hours makeover na-ekwu. Ha bịa mee ya ifu dị na-enwere ihe a na-akpọ standard family planning clinic. Ifu na-enwe waiting area, nwee counseling area. Ebe gị na nwaanyị ya nọ kpaa nkata zoro ezo maka na nwere okwu zoro ezo nwaanyị ama ekwu na ebe ndị ọzọ nọ. Gịnị akpa anya bụ nkata wee nwee nke a na-akpọ procedure room nye ebe anyị anọ wee mezie ya bụ family planning. Ka emesịrị ha and with ndị anyị na-akpọ ndị QIT quality improvement team bụ members of the community. Ha wee baa n'ime obodo wee gbasaba ozi ọma wee gwa ụmụ nwaanyị na enwebukwa lekwa ihe ndị na ka ụmụ nwaanyị bịazi ụmụ nwaanyị na-abịabukwa ebe ahụ mbụ bịa na ha amarozi facility ya maka na ọ dịzi ka ihe ebe ndị ọcha ha equipment tinyecha ma TV Teacher ma ihe dị iche iche ya ịfụtazie iwe aṅụrị na ịbịalụ ịnọ ọgwụ n'ọbụrụ ịnọ n'ụlọ ọgwụ anwụ adịrị achara mmiri ya na-eri gị maọbụ onye na-agafe agafe na-anọ ihe gị na mmadụ na-akarị so ụmụ nwaanyị dị very happy and emelụ ọbịbịa ụmụ nwaanyị na-abịa n'ụlọ ọgwụ gbanye nta maka na onye pụọ jekọọla ibi ya si ya jekwa ka ọfụ ihe na-eme ebe ahụ ndị na-agbagbu ọsọ na-ezobu ezo maka ihe magonu ka ndị be anyị si ewe family planning ndị na-ezobu ezo fụzie na ọ bụ ọzọ ịbịa ndị mmadụ abịa na-enyo gị anya na nwaanyị abịakwara ime family planning efu na ebe anyị nwezi privacy gị na mmadụ anọrọ kpaa nkata bara uru ụmụ nwaanyị na-abịazi eme ya bụ family planning maka ndị community sokwa na-akpọpụtafa na-asị bịa na ihe adị maka akụziri ha ihe dị na ya ha ghọta na ọdịmma so na ihe m kwuru bụ na ọbịbịa ụmụ nwaanyị na-abịa na facility ọ kwụsị ụmụ nwaanyị ma ụmụ nwoke ejizi opportunity a na-akọwakwara ụmụ nwaanyị ma nwoke ka ha na-akwado nwunye ha maka ime ya bụ family planning maka ihe a na-ekwu bụ na ọmụrụ ka ị ga-azụ ọ na-afịa nwoke arụ na-afịa nwaanyị arụ ya bụ na ọbịbịa a na-abịa na ya bụ facility ebe emere makeover 72 hours makeover na ọ bawanyere karịa otu ha si abịa mbụ
ndị emelu makeover or strictly for family planning ka a na-abịara ebe a ka onwe ihe ọzọ mmadụ nwere ike ịbịa maka arụ ike ihe ndị ọzọ dịka ọya ndị ọzọ
ịma na anyị nwekana ego ma nwekanụ space ime ihe ndị ọzọ iwu abụrụ na ọsọsọ family planning maka elu ebe anyị na-akpọ waiting area ilu ebe ahụ everybody will be there eme akọwa maka family planning kọwaa maka ihe ndị ọzọ dị iche iche mana iluzie onwezie ndị rụọ ọrụ na ha ya eme family planning agbabazie ebe n'ime ụlọ ndị a pụrụ iche ebe ya na-eme anyị na-akpọ counseling wee kọwaa alụfọ ọfụma ihe gbasara ya bụ family planning so emechawuzie nke abakwa na onwekwa ume ụlọ ọzọkwa ya abanye wee mee ya bụ family planning so ndị nke a bụ maka family planning mana ndị nke ọzọ ha anyị na-akpọ ihe anyị na-eme ya na-akpọ integrated approach like dịka immunization ha nwere ike iji ya na the waiting area mee counseling on everything concerning health a na-akọwa maka immunization a na-akọwa maka safe motherhood antenatal care a na-akọwa maka ihe niile maka na ịma na anyị nwekana ndị ọrụ so ha na-eji ofu iche tụgbuo so many nnụnụ ịghọtago so a na-anọ n'ebe a kọwacha ihe niile a na-akọwa ọ bụgodu mbọsị abụrụ maka family a na-anọkwa ebe a kọwara ụmụ nwaanyị maka family planning ya bụ onye chọọ ọnụ maka na ihe anyị na-ekwu family planning bụ na ịchọọ anyị ada afọs ya afọs ihe anyị na-akpọ informed choice ihe ejiri aka rụrụ ọrụ si na ị chọrọ ime ekọwara uru dị na ya ịghọta ịrụ ọrụ nke ị chọrọ ime
the makedebe this 72-hour intervention makeover na Anambra.
Okay, I mere ofu na Eziowere PSC Eziowere nke dị na Idemmiri North. In fact, the book I mere Idemmiri North PSC Eziowere mee na MCH Ogidi bịa jee na Ogbaru mee na PSC Okpoko 2 jee na Onitsha North mee na Christ Church health facility health post wee ha tiri mmọnwụ ha tiri ijele ebe a ilu ebe a klicha ife eme ime ekweta na alụrụ ya under 72 hours like you rightly said.
All right, Doctor, coming back to you, you said you're already in 12 states in Nigeria right now.
14 states.
Okay, 14 rather, 14 states.
And
expanding. Now, do you have any time that you say that you are done with a particular state and you exit the state, or is it a continuous partnership provided that you're collaborating and you're partnering very well with the state government?
Interesting question. So for every partnership, we believe that there should come a time where you actually allow the other partner to lead completely. And so we came up with this model where we call the lead, assist, and observe model, which is our coaching model. And basically what we do is in the first 1 or 2 years, we are showing the way, we are demonstrating our interventions. By the 3rd year, we start withdrawing, allow government to lead and drive the implementation. And by the 4th year, we pretty much just observe, right? And allow government to lead and drive. So at that point, we expect that the government would attain a point where we call a point of self-reliance. By that time, it should have been allocating adequate funding for family planning. It should be leading and driving implementation. Its healthcare workers would have been trained and well-oriented on modern contraceptive methods. We also expect that the facilities will have the methods, the consumables, the communities around those facilities would have been primed. At that point, we graduate the states. So when we graduate a state, we are not saying we don't have any business with you. We're just saying that we are not going to be actively involved in this partnership. But on request, when it is absolutely important, we can come in and provide technical assistance, And we do that so that other states in the country will also have the opportunity to experience what the previous states have experienced. So that is where we are in Anambra State after 4 years of very robust partnership. Right? Yes. So Anambra State has attained the status of graduation.
Should I ask whether there have been any challenges?
Absolutely. Absolutely, there has been a lot of challenges. Okay. A critical component of our work is change management.
Change, yes.
How do you change people's mindsets to say you are not just collecting donor funding and spending donor funding, but you're also bringing your own part to the game. You're also bringing your own resources. You're also being committed, as government to implementing, putting your hands on the plow and getting the job done. That is a huge change management process that we had to go through. And it was tough. It was tough. But we are very happy to see that over the years, there has been a lot of improvement. The healthcare workers are very excited about the services, the fact that they can provide services now, and people are coming to ask for services. I had the opportunity to visit one of the facilities, and I was blown away by the sheer number of people waiting to receive services. And I heard from the community that was something that wasn't the norm before. So I think it took a lot of tears and blood, of course, literally, but it happened. Another challenge that we really had is financing. And financing was tough because when you don't have budget allocation, for family planning, it becomes difficult to spend money. So the first point in having resources available for any development intervention is having the budget line allocated, having money in that line, then having the money released. And it was really tough for us to go through that process. But we're happy to see that Anambra State has a budget line for family planning now. It's allocating resources.
Because I want to ask you, at this point, where are we now in Anambra State, the level?
Yes, I mean, from what I know about Anambra State, they have gone a very long way from where we started. They have a budget line, they have funding released, and we are happy to see that periodically they are even spending their own monies to implement some of these programs, some of these high impact interventions that we have introduced. So that is a huge leap. And one huge success in Anambra State, I think I need to say this, is the involvement of traditional religious institutions in championing family planning. Before now, nobody wants to touch family planning because of this perception that, it is culturally inappropriate to talk about it. It is an issue of population control. There were lots of misconceptions and biases about family planning. But we have people coming out and talking openly about family planning. Family planning is being talked about in religious houses. And we developed some tools, what we call religious perspectives of family planning, sermon notes that people are using to engage with their congregants, in the churches, in the mosque, and all of that. And we're also seeing that community members, traditional institutions, and even volunteer advocates and champions are talking about family planning, and that is a huge improvement.
All right, we'll still continue with our discussion, but we want to have a street work on youth and family planning.
The youth family planning from secondary school. Maniha na kuzifanya aburo kafaje practice here. More man support ka the youth they are not practice here. Family planning akuziva or the mama. But when they get married, then they can now practice what they have been taught. Not as a youth without marriage. They are not practice here, not commit abortion, not many things. Can destroy their life clearly. So they should teach them that family planning is for the married. I believe so that it will help them. Makuzi and the youth, basa family planning. So when they grow up or when they get married, they will know how to practice it and protect themselves. Unwanted pregnancies, abortion, ebenata.
In fact, it's not possible incorporate into the school syllabus so that they are not secondary school. And what an idea about what it is. But imago the quest for a male child. This thing has been pushing people. And not even your wine. I've used wine so that in the youth now, they should get themselves equipped. Malna, if
it would be very, very wonderful if they introduce it to family plan, to the school curriculums and stuff like that. It would be very, very good. And it will also enlighten our youths. When they are doing things, they will know the preventive measures and stuff like that. Okay, me, I have a friend now that got pregnant and stuff like that in this early age. All those things, we must not be hiding everything from our young ones. We should start from the early age to start to be telling themselves that they need to hear and stuff that are meant to hear. So I don't know actually whether some people might be against it. They might say that they are too young and stuff like that. But also we'll find out that we still have youths that are younger than my age that still get married. So everybody needs to know about this.
Children should be taught about family planning from the early stage, so that when they get to the adult stage that they get married, they should be able to know and control themselves to avoid having more children or more children than expected.
All right, you're welcome back. Ayana chetagazo na anyabo mmemme no totwa. Ayana go kandi mmadu siwe ekwu ihe gbasala family planning, especially ebe gbasala ndị ntorobịa. Stella gị ka mma ajụ ajụjụ nke maka achọm ka ịkọwa kenelai maọbụ ọdịmkpa ibido n'ụmụazị maka ndị niile ekwula okwu si na ọ ga-amakwanụ mma na itinyere ya na ihe a na-agụ n'ụlọ akwụkwọ ya school curriculum ka ibido n'ụmụazị wee kụziwelu ha ulu na mkpa ọ dị mmadụ ime ihe ịmalụ maka family planning. So wee kwenye na ọ ga-adị mma ibido na nwata wee kụzibie kekwanụ uru ga-elite na ọ bụ na isi na nwata wee kụzibeli ya ụmụaka.
No kwesịrị ka ebido na nwatakịrị ya mgbe ha nọ school wee kwa afa maka family planning. And ihe anyị na-akpụ ya na school bụ life planning for the adolescent and youth. Ọ bụkara family planning per se, mana ọ gụnyekwara ma family planning ihe anyị akụziri ha maka na onye nwa bụ nwata emecha bụrụ okenye. So ọ dị mkpa ka akụziere gwava nke bụ eziokwu maka ọ bụrụ na ị gwara ha nwere ike mee mistake, ha nwere ike nweta the wrong information. So na ọ dị mkpa na agwara ha nke bụ eziokwu. Ihe anyị agwava ya enyelufe aka ka ha malụ nwee ike ọsị ka ya dịle etu ịnụ di ka wee mechaa program career ya ma ọ ka ime ihe ndị a ka ya eji kụziere ya ka ọ dịle etu ịnụ di ma ọ ka ọ dịle etu ịmụ nwa ka o wee luo oge kwesịrị na ọ ya je mụ nwa anwa maka na ọ sị my people die for lack of knowledge. Ọ bụ na knowledge is power. Ọ bụ na ha mara all those things they will make mistake. And onye abụtala high rate of abortion. Abortion, no, abortion, you will never believe it. And ha na-eme the wrong way. Abortion ha tutu ime because na ha draw informed. Ha je sikwa na azụ ka je wepụpụ ya. Mgbe ha na-eji wepụ ya, onye eme mistake. Ya nwee ike ibuta a very serious complication in their life. O nwere ike emezi onye ama ma ya amụsị na nwa. Ha je na nke ndị kwa aka. Ha na-eji spoke. Adụnye na adupu akpa nwa onwe ike o bleed be ma ọ bụ onwe ka ihe ọzọ bara ya onwe ike ọgbaba abụ ma o mebi nke ihe dị iche iche omini na ya ebepụ ya ba akpa nwa Adam ejigo ndụ onye ahụ for life. Mana ọ bụ na akụziri ya family planning gwa ihe o kwesịrị ime gwa ihe o kwesịrị ime ọ malụ ihe o kwesịrị ime na ihe o kwesịrị ime n'oge jiri n'oge maka sị na na-eji n'oge achọ ewu ojii na ọ bụrụ na chijicha.
Dr. Victor, now that your presence, it won't be highly felt again in Anambra State. The partnership with Anambra State, does it continue?
Yes, the partnership continues. For every state that we have partnered with and graduated, you know, they enter into what we call the TCI alumni network, which means that if any state within the alumni network can request for technical assistance to us, and we can deploy technical assistance, you know, to that state. But of course, it has to be technical assistance to do something that the state cannot do, you know, because we believe that having spent about 4 years, you know, working with the state, demonstrating some of these high impact interventions, providing our catalytic funding, stimulating the system to be able to self-sustain, the state should be able to continue with that. You know, the state should be able to consolidate, you know, on all of the interventions that we've done and continue to move forward. But we, of course, recognize that there are challenges, there are funding constraints, there's staff attrition, people retire, people move out of the state. Those are natural things that happen, but regardless, we expect that there should be some level of momentum, but we will continue our partnership with the state. And interestingly, any state that moves out becomes a center of excellence, which means that any new state coming on board can come to that state on the learning tour, you know, to interact and say, hey, how did you do it? You know, show us, you know, and all of that. So Anambra automatically enters, you know, our alumni network and becomes a center of excellence.
So now that we are among the league of the alumni,
yes.
So what's your advice to Anambra?
So what I would say is family planning is a fundamental right. Just the way you should demand for any service, any public good service, any public good, people should demand for service, for family planning services. And I also want to dispel the myth that family planning is an exclusive for married people. No. Family planning consists of family planning information and services.
Okay.
You need to have the information before you have access to the services, and everybody, young, old, married, unmarried, should have access to the information at the least.
All right, quickly from Stella.
On top of is the TCI app. Maka Isimukube assume that we are Oliver. Oliver Twist.
Want some more?
We want some more.
More, okay.
Yes. It's true they have stayed with us, but we still need them. You know? So what I'm saying is, it's been wonderful working with TCI. We've learned over the years, but it's not enough. We still need their technical assistance. We still need their business or usual model. You know? So that is what I'm saying for.
Whenever you have need for that.
Yes, that's depending on the criteria for calling them.
Okay.
That's if we meet with the criteria. So.
On that note, we want to say a very big thank you to you, Dr.
Thank you.
Victor Iyaro, Director TCI Nigeria. Thank you so much for being here.
Thank you so much for having me.
And also Stella Ekwozo, the State Family Planning Coordinator, Deputy Director Nursing in Anambra State Ministry of Health. Thank you so much for joining us.
Thank you, my sister.
Well, that's it on the show this morning. Thank you so much for being with us. My name is Chidima Oranwa. See you again tomorrow. Bye.